Hi, I'm Sarah Barton, and I have case number 1. So for case 1, the red flags were the fact that the patient's pain was cyclic. There was an insidious onset. The patient had fever, which is a constitutional symptom. The patient had a high blood pressure, so she was actually stage 1 hypertension. The patient had bilateral symptoms of the thoracic region when she was rotating. The patient had a higher BMI than what she was supposed to. There was a change in symptoms with food, so she had an increase in nausea and heartburn 2 hours after eating. She had a weak urination stream. She also is at an age where more problems can arise. She's 40, and so there are certain diseases and problems that can arise with that. Also, she's had multiple pregnancies, so that's another thing to look out for this patient. So 3 different systems that I chose were the cardiovascular system. So she had pain with reaching overhead, which could lead me to believe it's cardio. She is stage 1 hypertension. She has a relatively higher BMI than what she's supposed to, and then the pain is actually worse when she's lying down. So she also had MSK related issues. She had shoulder pain, and then that pain increased when she was reaching overhead, which could potentially be shoulder pain. She also had GI problems, so she had a change in symptoms with food. The referral pattern is actually similar to that of the digestive tract, so it could potentially be pancreas, liver, gallbladder, because of the fact that she had right shoulder pain and then pain mid-thoracic. And then she also had the nausea and the heartburn after eating. So some of the other questions that I would ask this patient was for the cardiovascular system. Has she had any lightheadedness? Was there any sweating and she wasn't really doing anything vigorous? Has she had any night sweats, any malaise, shortness of breath, in general, lying down, shortness of breath? And then has she had any palpitations? For the MSK, I would ask about if there was relief at night or if it just kind of was continuous. And then I would ask about any trauma. Was it actually an insidious onset, or does she remember anything specific? And then has she ever had anything like this before? For the GI, I would ask if there was any vomiting, if she's done any of that. So she mentioned the diarrhea and the stool and everything in the case. And then if there was any change in appetite, and then how is she before food versus after food, and then does the pain kind of lessen after she's belched or passed gas or anything like that, and then if she does change any position, does it relieve the pain or is it still kind of constant? Because I know with a lot of the gastrointestinal pain, it can be relieved with a fetal position. And then does she feel better with after a bowel movement? So those are the follow-up questions I would like to ask, just to kind of get more insight. So I'm going to go ahead and get my patient. Hi Kayla, how are you? I'm Sarah, I'm a student physical therapist. I'm going to be doing your exam today, and my CI, Dr. Campbell, is going to observe. Is that okay?
That is.
Awesome. So today we're going to go ahead and do an abdominal exam, just because there are some things that I'm nervous about with that. The fact that you've had mid-thoracic pain, the fact that your BMI is a little bit higher than what's supposed to be. Also the fact that you've had shoulder pain. It's a common site of referrals for a lot of your abdominal organs. So I just kind of want to take a look and just see what we're dealing with. Is that okay?
Okay.
All right. So if you're comfortable with it, I'm going to go ahead and have you take off your shirt, okay?
Okay.
And I'm going to go ahead and grab a towel and my stethoscope. And I'm going to come on the opposite side of you. All right. So Kayla, what we're going to do first is I'm going to go ahead and I'm going to tuck this towel in, just kind of give you a little bit more cloth there. Is that okay if I do that?
Mm-hmm.
Okay. All right, there we go. So for the abdominal exam, I'm going to go ahead and I am going to kind of inspect. I'm going to see kind of Is that okay?
Yeah.
Okay. I'm just gonna kind of see if I notice anything that shouldn't be there. So I'd look for like striations. I would look for discoloration, any tumors, anything like that, any abnormal moles, anything like that. So I'm gonna go ahead and just look around. So I don't notice anything. All right. So next I'm going to go ahead and I'm going to auscultate. And so what that is I'm going to listen to the sounds that your bowels make. And I'm going to listen into the different quadrants. So I'm going to start in the lower right hand and then I'll go up and around, okay? And then after that, I'm going to listen to your pulses, but I'll explain that a little bit later, okay? Sorry if it's a little bit cold. Doing okay still?
Mm-hmm.
All right. So that was normal. Normal being anywhere between 5 to 34 clicks there. And so now that we've done that, I'm going to go ahead and listen to your pulses. So what I'm going to do is I'm going to go ahead and I'm going to start with the abdominal aorta, and that's in your epigastric region. So I'm just going to come above your belly button just a little bit. So I'll listen for that, and then I'm going to go over and listen to your renal after that, and then I'll come down a little bit, and then I'll listen to your iliac, and then I'll listen to your femoral. So for your femoral, I'm going to have to go ahead and put my stethoscope in here a little bit. So when we get down there, what I want you to do is take your hand onto the towel and find your bony prominence. And then from there, rest that hand on that bony prominence, and then I'll take your ASIS in between the ASIS and the bony prominence, and then it's going to be halfway between that. So just kind of let you know that that's what I'm going to do. Are you okay to start? All right. So go ahead and we'll put your hand, sorry about that. All right, help you for the ASIS, all right. All right, good. All right, doing okay still? Okay. All right, and then I'm gonna come off the abdominal aorta since I already listened to that. Now I'm gonna listen to the renal on this side, okay? All right, thank you. All right, so I'm gonna go ahead and find it on this side. There's your ASIS. Good. All right. So everything appears to be normal. I don't hear any bruits or anything like that. Any swishing in any of the abdominal aorta. I don't hear anything in any of the other stuff that I'm not supposed to hear. So after this, I'm going to go ahead and take this off there. It's getting in the way. After that, I'm going to go ahead and I am going to percuss. So what I'm going to be doing is I'm going to be taking my middle finger and I'm going to be hitting it with my other hand, and I'm going to be listening to a change in the sounds. So if I'm over organs, I'm going to go ahead and I'll hear like a dull sound. And then if I'm over just air, I'm going to hear a more tympanic sound, okay? So I'm going to go ahead and do that throughout all of the quadrants, okay? So now after that, I'm going to go ahead and I'm going to palpate. So what I'm going to be doing is I'm going to take my forefingers and I'm going to go just a light palpation, just kind of like a centimeter or so deep. Let me know if you feel any discomfort or anything like that. And then after that, I'm going to go ahead and palpate slightly deeper. Okay? Alright, now I'm going to go slightly deeper, okay? And same thing, just if you feel anything, just let me know, okay? Good. Any disturbances? Okay. So next I'm going to go ahead and I'm going to palpate both your spleen and your liver, okay? So your spleen is on your left-hand side in the upper quadrant. So I'm going to go ahead and come over here and palpate that. Any tenderness, anything like that? Okay. So next I'm going to go ahead and palpate your liver. So what your liver is, it's kind of tucked beneath the intercostals of your right-hand side. So I'm going to go ahead and palpate that. Go ahead and breathe in, breathe out. Any tenderness or anything? All right. So next I'm going to go ahead and do my special test. So I'm going to go ahead and do Murphy's sign. So what that is basically kind of like the palpation. I'm going to go ahead and I'm going to have you breathe in, and I'm going to go ahead and push down. And then if you feel any pain, anything like that, then that would be a positive test. But then I would just kind of gauge it from there, okay? All right, go ahead and breathe in. All right, and breathe out. Any pain? All right. Is it okay if I untuck this? Mm-hmm. Okay. All right, and you can go ahead and put your shirt back on. Okay, so with the Murphy's sign test, had she been an actual patient and been symptomatic, she would have had tenderness or pain when I pushed into it, because I would have been, when the person inhales, the gallbladder gets moved down into my hand, and so I would have been pressing more so on the gallbladder. So it would have been tender, it would have been painful, she would have been kind of guarded and maybe like winced a little bit. And the Murphy's sign test is testing for cholecystititis, and so I would go ahead and say that would be in the GI, and I would go ahead and say that it would be that because of the fact that it's referring pain to the right shoulder, it's referring pain to the mid-thoracic, and also the positive special test that I did. I would refer her to her PCP, and I wouldn't treat her. I would go ahead and call the PCP and just kind of explain my findings to him and see where he wanted to go from there. But I would probably just refer her out to her PCP because it is not a medical emergency. So.